Ana Maria Gimenez-Arnau. I am professor in dermatology. I'm focused on immunocutaneous allergy, and my hospital is Hospital del Mar and the Universitat Pompeu Fabra. This is Barcelona, Spain. The session where I am involved is entitled "What's New in Chronic Urticaria?" And my speech is focused on a special type of chronic urticaria, such that can be induced by physical or environmental factors. For example, friction or pressure, or exposure to the cold air, cold water, exposure to the sun, to the heat, or when we increase the temperature of the body. Then this type of inducible urticaria, which are not really extremely frequent, but extremely important because they impair the quality of life of the patients, nowadays they need to be diagnosed accurately with provocation tests. And we have very good news because there are different new coming treatments that are nowadays developing for the management of inducible urticaria. There are different clinical trials and different new drugs extremely effective to control those signs and symptoms. A person who cannot go outside because the UVA or UVB or visible light, or they cannot do sport, or they cannot do ski, or even they cannot swim in a swimming pool because they suffer from cold urticaria, they will have a brand new optional treatments will control the disease as much, and they probably in the future live better. My impression of this Congress, the American Academy of Dermatology, is that we have a lot of young people attending it. Then this new blood in dermatology, and it will be very interesting that such new blood will be distributed in different fields and not just in one field. Then I hope we will have interest for the new biologic treatments which are driving for immunocutaneous allergy diseases, eczema, that means atopic dermatitis, urticaria, also chronic hand eczema. We have a very good new topical treatment. Then there is a revolution really on the biological and small molecular very active treatments for the different cutaneous diseases that traditionally were from unknown origin, very difficult to treat and very really suffered by the patient a lot. Then we have a good perspective, good new future, new blood and new options for treat our patients. My future is my present, because we already spent many years developing the future where we are now, in the sense that we already accumulate experience and we learn a lot from the patients, we learn a lot from our cooperation with the pharmaceutical companies, and we learn a lot from our colleagues. My personal future will be continue to enjoy how to do and to give for my patients the best treatment options. Obviously, this requires an open mind. This open mind means high-level basic knowledge about how are these diseases. Obviously, needs constant interaction with our colleagues, working in networks for urticaria, networks for contact dermatitis, because just working with networks, international networks, global networks, we are really learning about the reality of our patients. Then my future is my present now, and I hope it will be during the next few years.